GPT and medical education website that uses large language models to generate answers. So on the left side of the screen here is where we can select a particular large language model that we're interested in. I have a variety of options from OpenAI, Anthropic, Google, Meta. Here, let's use the OpenAI model, this GPT 3.5 Turbo 16K. And this is an educational screen where you can learn about concepts, basic concepts. Typically, these tools, because they're static, they don't update in real time on the web, except if you add features like I'll show you in a moment. You can't expect updated information for the latest, greatest treatments for things. On the other hand, a lot of basic physiology is stable. And here, let's explain the Frank-Starling curve. Click Enter. And because I requested using an analogy here, GPT 3.5 responds with, imagine your heart as a rubber band. As you stretch, it gains potential energy, and then goes on to explain this. You can download this information, and you can keep a conversation going as well, or stop and move to a new topic. So, teaching some standard physiology basic concepts. Let's go to draft communication. This is something from the electronic health record context. We're all overwhelmed with our in-baskets. What can we do to help? Can large language models help us? So here we could annotate a patient result. We get these results, and it takes a fair amount of time sometimes, especially if something's somewhat complicated. And here, let me go to a sample lung CT scan report that's kind of very vague, multifocal, randomly distributed, non-rounded ground glass opacities. Let's see, how would ChatGPT provide a draft for us to annotate that message? So if we click Generate Annotation, I've received your lung CT, some areas of hazy appearance, happen for various reasons. And since they called out COVID-19 as a possibility in this impression, you could say one possible cause, or not to jump to conclusions without further evaluation. Happy to discuss at your next regular visit, questions or concerns. Anyway, kind regards. So can help us with drafting some messages. Can also do this for a variety of other report types. I have another sample ECG report here. You could try different models. You can also generate a sample report, and here even request a mildly abnormal. It can do a CT scan, but let's do a chest X-ray. And we could generate our annotation when we get that report back. You can play around and see how this would work, or you could put in your own content here. No PHI should be included, but this gives an example of how this would work. It's going to be incorporated in our electronic medical record soon. Patient education. Let's say we have a patient with these 3 different diagnoses. Typically, we have handouts focused on one, not all 3. Nice thing is here, custom recommendations. Often these things, these basic advice sorts of things don't change dramatically, but sometimes they do. So we are using static large language models. These aren't accessing the web, except when I'll show that in a moment on this Sift the Web feature. This is static content from September of 2021, meaning the model is static. This is generated dynamically on the fly when we put things in. And here it's blending these conditions together with some advice overall. You can bring up grocery lists, that sort of thing. Differential diagnosis could provide clinical data for a specific patient, or often what I find useful is what else should I be thinking about in this context? So say we had a patient, we were thinking they might have Lyme disease. What else should I still be thinking about might be behind this? And so here we generate a variety of different potential diagnoses, from rheumatoid arthritis to others. So you get the idea here. I mentioned earlier, a moment ago, about sifting the web, and that these are models that are fixed in time until they get updated behind the scenes. Sifting the web, here, let's do a search for the current treatment of Lyme disease using the internet and a reliable website. We can select domains. I put in a few. It can focus on those, pull content off those sites, and then summarize that content. See how quickly it's actually responding here. It actually read from medscape.com, looked at the treatments, and then is summarizing treatments for us based on that and giving us links so we can look at more information as well. Another feature is with articles. We could interact with articles, have questions and answers. Some of you may have seen that. In the interest of time, I won't do that one, but you upload an article here, it parses it, and then you can ask questions about it, and it'll summarize the article for you. Thanks so much.